Hello, everybody. My name is Dr. Flo Tseng, and I am the Associate Dean for Diversity, Inclusion, Equity, and Climate at the Cummings School of Veterinary Medicine at Tufts University. My background is as a wildlife veterinarian, and so I did give a little talk about that before. But now I'm here to talk to you about things like diversity, equity, and inclusion in the veterinary profession. So, my position was established about 3 years ago, and right at the beginning of the pandemic, but also right when, before George Floyd was murdered and a lot of other social justice issues came to the forefront. So I'm so glad that I'm able to kind of swivel from being a wildlife veterinarian to doing something as important as this for our school, because there's definitely a need, not only certainly at our school, but in the veterinary profession. So let me talk to you a little bit about that. Why are we talking about this? And hopefully, everybody knows these sorts of reasons, but this kind of knowledge is really foundational because it dictates how all of us interact with the world around us, including, our friends, our family, our peers, et cetera. And certainly when I talk about this to our veterinary students, I am trying to set an expectation for professional conduct, not just here, but when they graduate as veterinarians too, because it's very important for everybody to recognize different sorts of diversity and be respectful of everybody's differences. And so, I also try to talk about different ways to communicate with diverse audiences, and give them some tools, some actual tools to help build a team. And certainly, in a larger sense, there's a lot of benefits for having diversity in our daily lives. A diverse, for instance, college undergraduate population really lends itself to a lot more open discussion with different viewpoints that people may not necessarily hear if you were in a really homogeneous environment. And then the hope is that, when I talk about this with our students and with you, it gets you thinking about some of these issues, and you think about different kinds of systemic inequities that are present in our society, and maybe even work, beyond knowing about those to, trying to do various actions towards social justice. Okay. So here's a brief history of diversity in the veterinary profession. And I'm going to tell you, this is just probably about half of the presentation. I actually thought it would also be interesting for you to hear a little more about Cummings School, since it's the only veterinary school in New England. And I'm, going to take you on a tour of the hospitals also. So we'll just start with this part first. So of course, there has been a history of racial inequities in our country, but also in veterinary medicine. Between 1889 and 1948, there were only 70 African-American veterinarians that graduated from all the vet colleges in the US and Canada. And the first ones to obtain their degrees were Dr. Henry Stockton, and at some point, Harvard actually had a school of veterinary medicine. He graduated from there. And then the fellow that's pictured here, Dr. Augustus Lushington, who graduated from the University of Pennsylvania in 1897. Now, these Midwestern schools were largely responsible for a lot of the different graduates, African-American graduates. And, that's sort of an interesting side note. There's a lot of different reasons for that, but most of the veterinarians that did graduate went into the same things, right? That white veterinarians or other, people of color went into private practice, meat inspections, sometimes college veterinarians at historically Black colleges that were founded as agricultural schools, right? Like Tuskegee, for instance. Okay, so speaking of Tuskegee, Dr. Frederick Douglass Patterson and E.B. Evans were the ones that established Tuskegee Institute in Alabama, the veterinary school at Tuskegee Institute. And they it's amazing that they were able to found a veterinary school, because certainly Tuskegee at that time, and even now being a historically Black university, doesn't have, say, the financial support similar to, say, Harvard. And also this was, a rigidly segregated educational system at that time. This is during World War II and post-World War II. So their faculty were mostly graduates from northern schools, but it was really difficult to recruit faculty because, a lot of people, that were people of color didn't want to go to school in Alabama. You can imagine why. And also student recruiting was a problem. So they only started out with 8 faculty and 13 first-year students with 19 undergraduate pre-veterinary students. But now, certainly the veterinary school has been present for a long time at Tuskegee University and is really, at the forefront, I think, of being able to offer courses, say, to a lot of people of color. Okay. First 2 African-American women graduated in 1949, so that took a while. One from Pennsylvania, one from Tuskegee. And it wasn't until 1972 that kind of organized veterinary medicine really noticed the lack of diversity in veterinary medicine. And so there was a workshop that was held at Purdue. Purdue is certainly one of the veterinary schools that is at the forefront of efforts in DEI. And at that time, the number of all minority students, not just Black students, was only 2.2% at U.S. veterinary colleges. So there's a long way to go. AAVMC, which is the American Association of Veterinary Medical Colleges, did adopt recommendations to save a given number of seats for minorities, with a goal of reaching a percentage of 15%. But that was not well received among schools of veterinary medicine. And if you've paid attention to any Supreme Court decisions, you'll know that, any program like this that has some sort of quota is not legal at this point. Right now, we have race-conscious, holistic admissions policies in most veterinary schools. There are 9 states in the US, including Michigan and California, that have passed state bans on using race-conscious admissions. And so they've had to use many other what are called race-neutral decisions in order to hopefully recruit minorities into their programs. The Supreme Court decision that is coming up on affirmative action with the conservative majority may certainly act to ban race-conscious admissions totally. So a lot of us are scrambling and trying to figure out, okay, what's our next step if this is what comes down. But in any case, veterinary students that were African-American, still only 3% in 2020. It's a little bit higher now, but not much. It's not even 4%. And 70% of the African-American students go to Tuskegee. So, the rest of us have so much work to do. It's encouraging, there were a few more, 4.3% African-American applicants, but it's still not enough. And so, obviously we have to start with students that are younger, right? And introduce them to the veterinary profession, and have role models that can say, this is me. And yes, I went through veterinary school successfully, and I have, a career that I'm very proud of. And that's what we're all working towards. So you can see certainly, though, that in all of the veterinary colleges, the underrepresented in vet med groups, which are, a lot of different racial and ethnic people of color, has definitely increased from, the lows that I was showing you, back in 1976. And so, right now, this graph shows 20-some%. And actually, I was just at the national meeting of the AAVMC, and we're now at 25%. So, that's definitely an improvement, but still, I feel as if Black and Brown students are not as well represented in these numbers. Okay. And then, if we're going to talk about diversity in different forms, certainly gender in veterinary medicine is an important topic. the first woman who graduated from a U.S. vet college didn't graduate until 1903. The Women's Veterinary Association was then founded in 1947. Still, most veterinary schools at that time only had maybe 2 women, with the theory being, you couldn't have just one woman because that woman definitely needed support from somebody else. And so that's pretty much how it was. And actually, incidentally, that was the same thing for Jewish students too, maybe 1 in a class, but no, let's make it 2, right? So there was still quite a bit of discrimination, as you can imagine. And back in 1963, the Equal Pay Act prohibited paying women less than men for the same job. But as you know, still women make significantly less than men on the dollar, right? The first female president of the Association of Veterinary Medical, American Veterinary Medical Association was Bobby Chancellor in 1977. I actually entered veterinary school in 1977 at Cornell, and my class was the first one to have more men or women than men. So the trend definitely has continued. In 1986, female students make up more than 50% of the enrollment for the first time. And then certainly nowadays, most vet classes are about 80% women. So it's definitely skewed in a different direction from where it was historically. And so you can see that, in this graph. Students who identify as female, really high now at 80%. Students who identify as male, lower. And there are, potentially a lot of reasons for this, some of which apply to students of color, right? Because if you're going to go through 4 years of college and then 4 years of veterinary school, that's a significant student loan for many people. And definitely veterinarians are going to earn less than MDs. So, you have students who think about that and think, what's my debt to income ratio? And I think I better go be a people doctor, even though my love is with animals, because I'm going to earn enough to pay off my student loans. Now, right now, there definitely is a shortage of veterinarians. Excuse me 1 second. And so now our graduates are actually getting offered a lot more than they used to be. So that debt to income ratio is slowly coming down, which is terrific. Okay, so at the Cummings School, these are different kinds of diversity, equity, inclusion resources. The Associate Dean, that's me. We have a Tufts Veterinary Council on Diversity that is faculty, staff, and students, and mostly focuses a lot on educational sorts of events and heritage celebration months and things like that. I've just convened a new Diversity, Equity, Inclusion, and Justice Committee, DEIJ committee, that is also students, faculty, and staff, but we are focusing more on behind the scenes, policies, procedures, those kinds of things. At the beginning of the pandemic, we formed an anti-racism task force because Tufts University has said that we are striving to be an anti-racist institution. And this task force worked for a year with me, and then was sunset in June of 21 to develop our strategic plan, okay, which we are, in the middle of trying to get things done. So on the university level, there were 5 anti-racism work streams that made over 181 recommendations that were discussed and implemented. So the strategic plan that we have for the veterinary school has come from some of these recommendations. We have just hired a new vice provost for DEIJ. And then there are, definitely university-wide committees. I feel like I'm on like 6 different ones already. So, okay. So if anyone has any questions, certainly you can put them in the chat. I'm going to kind of swivel now to the Cummings School. And I don't know how much you know about our school. I know some of you may have visited, but we have a a person in my office who is our recruitment and outreach director, who'd be happy to speak to any pre-vet students at Maine, University of Maine. And then our admissions office, is definitely there in order to counsel students after they've applied. And, the application process for all veterinary schools in the US follows pretty much the same pattern, where almost all, except for Texas A&M, use the common application. It's called VMCAS. And if you go to the website for the Association of Veterinary Medical Colleges, there's a whole lot of information on the application process and, recommendations for things to do. So, before you're applying, we are hoping that certainly you have good grades, because that's an important part of it. We do not use the graduate record exam as part of our admissions process. We phased that out several years ago because of, known bias, again, against people of color and even women in the GRE. But we're looking at things like your animal experiences, both breadth, like, what kinds of animals have you worked with, as well as depth, right? Like, what have you really worked with a lot? Maybe you've done a lot of small animal work too. You've done, had some horse experience or, some wildlife experience, et cetera, too. But we want to see that you're engaged in those kinds of activities before you're admitted. We're looking for students who are leaders, right? Because when you're part of a veterinary team, you have to be a leader. And so we're looking at leadership experiences and different extracurricular activities. And then certainly there are essays, there are standard essays through the VMCAS application process, but also when you apply, you can apply to different schools through the Common App, but each school usually has their own kind of requirements, and we have a separate essay also. So once you apply, we have people that read all the applications, and we got close to 1,300 this year. Our class is 105 people, so pretty competitive. But also, we read a large majority of those applications. And then some, maybe like 400 or so are selected for interviews. And now our interviews are just via Zoom, but we do have an accepted applicants day where you can actually come and, visit the campus, but certainly, and then, scores from the interviews, scores from the readers, and GPAs are all considered for the final list of people to be admitted. So, it's a pretty strenuous process, but again, there are people that can help you and lots of information online. Okay, let me go ahead. So I'm going to show you through some of the Cummings School hospitals, because we have quite a few. So the busiest hospital is the Foster Hospital for Small Animals, because this hospital sees about 35,000 cases a year. So that's huge. And, during the pandemic, it was even harder because, people were out with COVID, for instance, but they were getting pets. So more and more people definitely were bringing their animals to our small animal hospital. And within the small animal hospital, like I said, it's over 35,000 animals a year. This is the lobby area. There's a lot of specialty services. So this is why people come to the veterinary school. A lot of people will start with their neighborhood veterinarian, right? The private practitioner who sees routine things, but then maybe there's an animal, say, with a heart problem, right? So there are private specialty hospitals that, do have cardiologists, but sometimes even those places do not have all of the equipment and the expertise that we have. So we're almost like a tertiary care facility, and you can see some of the different subspecialties also on this list. So there's a lot of different services in the small animal hospital, and our students do core rotations through most of these in their clinical year. Also, the hospital for large animals, which mostly sees horses, but also sheep, goats, the occasional pig, occasional cow. And again, there's specialty services within, those large animal hospitals. And so you can see some of the different ones, including sports medicine. So race horses, right? We have, or eventing horses that come to us that may have injuries, lamenesses, things like that. We have a big equine exercise arena where they can be evaluated. And we have experts in doing different kinds of surgeries, right? For say lame horses or, horses with colic, which is like a GI issue. So anyway, lots of specialty services within the large animal hospital too. Also the wildlife clinic, which I talked about earlier, so I'm not going to go into detail, but we see about 4,000 wild animals a year. So we have our standalone clinic, and I guess I'll give you a little more detail. So again, we're providing medical and surgical care for all native wildlife species. And here's the breakdown about, of the kinds of animals we get. People do bring us, wild animals that they have found that are sick or injured or orphaned. Most come from the general public, but, we also work with state and federal wildlife agencies like the biologists, who mostly are the ones that are going to bring threatened and endangered species to us because we're a regional center for care. And then there are wildlife rehabilitators, people who are permitted by the different states in order to care for wildlife. And the reason I have a porcupine here is because this is my favorite adult mammal that comes in. I love the baby possums. Well, baby porcupines are adorable also, and you won't believe, but the baby porcupines are called porcupets. So how cute is that, right? And I love the adult porcupines for many reasons. We have a low-cost spay-neuter clinic on our campus that does high-volume surgeries for shelter animals, and also for cats in the community, for low-income population, we'll do spay neuters there. Also, there is shelter dog dentistry, and it gives our veterinary students a chance to work on their surgical and dental skills too. We have a program at a local high school. So this is the Worcester Technical High School. Worcester is the nearest, large city next to us. And we have worked with the technical high school to build a veterinary clinic on the campus of the high school, where the veterinary assistant program at the high school students come into the clinic and they're trained by our veterinary technicians. Our veterinary students go to the clinic and they're the primary clinicians for animals that are brought to us from lower income residents, right? And so this is subsidized primary care for their pets, but the students will get really good surgical experience, not the fancy stuff maybe that's done in the small animal hospital, but, basic things that you would need to do as a veterinarian. And so it's just a terrific program because it really is beneficial for the community, for the high school, for our students, for the lower income pets. So all of those kinds of things benefit. We have veterinary field services, which is our ambulatory service. So these are the folks, they're located in our little campus in Woodstock, Connecticut, and they do travel out to the farms. So they really have a very wide geographic area that they cover. And they'll do horse and cow and small ruminants, sheep and goats, et cetera. But usually it's, it's from the truck that goes out to these farms, and our students ride along and they're helping and learning about these farm practices too.